I like to say that I work in the intersection of epidemiology, policy, and financing. So I was born when my mom was a resident, so I spent many a night or lunch or mealtime in hospitals. I always heard stories from her about patients who literally would look at her and bring out their checkbooks and say, I can either feed my daughter or I can buy my medicine. And I've always been interested in how people, to me, arbitrarily can access or not access care, and really interested in the systems that set that up. I'm very interested in creating evidence-based but cost-effective programs. The administrative burden on physicians can be overwhelming. If I were to enter a clinic today and I'm faced with a physician who knows that he has to cut his budget by 30%, but he also knows that he needs to be reaching out to his patients once they're discharged, he needs to make sure they're taking their medicines and having the follow-up care that they need, then I'm going to work with that physician to establish outcome measures and tracking reports and communication systems to ensure that he's delivering the care that he wants to deliver and also doing it in a financially responsible way. So here at the Harvard School of Public Health, I'm the co-president of the Women in Leadership organization, and we work to provide opportunities every month for women to come together and discuss opportunities that they can take advantage of to become emerging leaders. And so what we try to do is provide workshops and speakers and forums for students to speak with established and emerging leaders about how they've got to where they were and how we can overcome some of the barriers in the workplace. So after I graduate, I plan on working at Emory University Healthcare System as an administrative fellow. And so I'll be working to look at how we can cut down the burden of unnecessary expenses, renegotiate contracts with suppliers, and also how we can improve our ability to fund additional care for this growing population. So Harvard has given me the skills to speak the language of researchers, providers, policymakers, and patients. And I know that I can translate complicated data and information into practical programs.